Hi, I'm Dr. Ganesh Nagarajan. I head the GI, liver and pancreatic cancer division at the Nanavati Max Institute of Cancercare. This is just to share an interesting case to highlight how an entire team works to try and help a patient come out of a difficult situation. And one of our many success stories, but it's just something that it's always good, feels good to highlight some of these points. So this was an elderly gentleman, almost 65 years of age, came to us in the emergency with, he was in a bad shape. He had bled into the abdomen. On a scan, we found that there was a tumor in the liver, a large one, almost 10 or 15 centimeters in size, which had ruptured into the abdomen, and he had bled torrentially. He came to the emergency in a bad shape. So when we looked at the scans, we found that, because there's active bleeding, we need to block the bleeder. So immediately our interventional radiologists, did a procedure at night itself to try and block the bleeding vessel, and they were successful. The bleeding stopped. He was in the ICU for a few days. He recovered. We gave him a lot of blood product, got him back to normal. He still had a fair bit of blood in the abdomen, but the bleeding had stopped, and that's why he had recovered. Then the question was, now that this tumor has bled, and now we've controlled the bleeding by an interventional radiology procedure, we've blocked the bleeding vessel. What do we do next? Patient had taken other opinions before they came here, and they were told nothing much would be possible. This is a very large tumor, and surgery would be very risky. We realized that once the tumor has bled, it can bleed again. And overall, we found that his remnant liver, the amount of liver remaining after we would remove this tumor, was good enough. Overall, he was in good health. He was a good candidate for surgery. It would be a major surgery. It would be a risky surgery. But we spoke to the family. We said that, you leave this tumor behind. Anyway, you're not giving him much of a chance. We take some risk. We go ahead and get this tumor out. It was a 7 to 8 hour surgery. We had to do what is known as total venous occlusion, where we had to block his vena cava above and below to try and get this tumor out, which we did. Our entire team, the surgical team, our anesthetists, everyone contributed. Everyone, had to use their expertise. And everything went well. The patient's tumor came out, and he recovered uneventfully, went back on post-operative day 6. I saw him a month back. This was around almost 2 years after his surgery. We'd done a scan. He's been on a regular follow-up. He's absolutely disease-free, and he's a ray of hope for all our patients. And he's one of the most active members of our Nidarr Hamesha team. He comes and attends meetings encourages other patients, gives them a lot of hope and confidence. And I think these are the kind of patients who make us feel good about what we do every day. Thank you.